Yes, everyone, good evening. So we can start now. Okay, I will show you all the questions. So there was the exam of 20 questions, right? So I will show you the question. After that, you please answer me. Yes, okay. Right. See, first question I'm showing you now. First question. See, which of the following is not seen in both schizophrenia and depression? Right, we have to understand here that some symptoms will be similar in both, like suicidal tendency will be seen in both. Overall, I'm sure you're able to recall that depression is the most common cause of suicide. In depression, suicide rate will be approximately 10 to 15%. In schizophrenia, 5 to 6%, right? Social withdrawal, yes, social withdrawals will be seen in both. See, lack of interest in daily activities, lack of sexual interest, yes, it can happen. But what about option number C? This is seen only in schizophrenia. This is, see, formal thought disorder like derailment, loosening of association, neologism, tangentiality, right? These are seen only in schizophrenia. Next question. A 35-year-old female presents with low mood, loss of hope, sleep disturbances, least concentration, lack of energy, feeling of worthlessness for last 4 weeks. Which of the following drugs is the first to be given? So first of all, what is the diagnosis here? Yes, this is a case of major depression. This is a case of major depression, right? See, depression is more common among females. Ratio will be 2 is to 1, right? Minimum there should be 5 symptoms like lack of food, lack of mood, lack of energy, lack of attention, concentration, negative thoughts, lack of energy, right? Suicidal thought, feeling of guilt, anhedonia, weight loss. Minimum 5 symptoms for more than 14 days, right? 100% this is a case of depression. And yes, SSRI is the first line drug, right? See, SSRI is the drug of choice for depression. So out of these four, answer is B. I'm sure you would have marked this answer correct. Okay. Chalo. Next question. A patient is not able to express his emotions normally after road traffic accident. There can be injury in which of the following? Okay, there can be injury in which of the following anatomical structure? Okay, are you able to recall that limbic system is responsible? Limbic system is responsible for generation of emotion, and limbic system is made up of mammillary body, amygdala, thalamus, cingulate gyrus, hippocampus, and hypothalamus. So can you answer me here? Now, what should be the answer? Anhedonia. And what is the meaning of anhedonia? When a person is not able to enjoy in old activities, right? Here answer will be C. C is the better answer. Next question, question number 4. A 19-year-old boy is presented with complaints of hearing some voices and aggressive behavior for last 48 hours. Okay, means only for last 2 days, 48 hours. He had a fever before these symptoms. Family members are reporting that he is actually talking to someone. So patient is having what? See, patient is having auditory hallucination also. Okay. After that, patient is able to see someone. Symptoms are there. Psychiatric symptoms are there, but there is no history of any psychiatric illness before. What is the most likely diagnosis? Although yeah, symptoms are like 100% like schizophrenia. Symptoms are like schizophrenia, right? ठीक है, symptoms are like schizophrenia, but for schizophrenia, okay, minimum there should be two symptoms or more than two symptoms for more than 1 month. This is as per ICD-11 guidelines, and more than 6 months as per DSM-5 old criteria. ठीक है, but here patient is having symptoms only for last 2 days, that too because of fever, and symptoms are less than 1 month, then it will be called as acute psychosis. Acute psychosis. I hope this is clear to everyone. Here answer is D, acute psychosis. All right. Next question, question number 5. After abusing a substance, a person is presented with red eyes, feeling of derealization, floating in air, and increased appetite. I have taught you in detail that if a person is going to abuse cannabis, after that, red eyes. And when he will enter the home, he can he can eat, he can have 5 plate biryani alone. Okay, fine. So he will be eating a lot. He will be having a lot of water also. Basically, this is a case of what? Cannabis abuse. Out of these four, yes. This much point is clear. Here answer will be marijuana. Marijuana. See, cocaine is what? CNS stimulant. Alcohol is a depressant. Heroin is what? Opioid. Can you tell me what are the symptoms after overdose of heroin? CPR. Patient will be in coma. There will be pinpoint pupil and respiratory depression. I hope you are able to recall all these points. Next question. See, question number 6. A 53-year-old male, a chronic alcoholic, tried to stop taking alcohol after several requests by his family members. After quitting, he started feeling uneasy, nauseating, and headache, insomnia. During examination, he was shaking and having profuse sweating. He was agitated and abusing the people around. What is the appropriate line of management for this patient? So this is a case of what? All symptoms are related to alcohol withdrawal. Okay? All symptoms are related to alcohol will be seen after 6 hours of stopping the alcohol. So what is the first day? After 6 hours, there will be tremors. And after, say, more than 12 hours, alcoholic hallucinosis. There will be auditory hallucination. More than 24 hours, seizure will be. So this is a case of delirium. Yes, this is a case of delirium tremens. Okay, where person will be completely disoriented. Patient can have visual hallucination, auditory hallucination, tactile hallucination. So how to treat? Remember, delirium tremens is an emergency. If you do not treat on time, mortality rate will be 20%. So how to treat? Right? Benzodiazepine injection with injection of thiamine. Question is that why do we inject a thiamine? So that we can prevent one more emergency like Wernicke's encephalopathy. Here answer is C. Next question, question number 7. A 55-year-old person is suspecting that which are not audible to other people. These symptoms are improved when he was started on haloperidol. First of all, in this question, patient is having delusion of persecution and auditory hallucination. So these are the examples of positive symptoms. I have taught you that in schizophrenia, there can be positive symptoms, there can be negative symptoms. So positive symptoms means what? Symptoms not there before, but now these symptoms got added: alexithymia, anhedonia, asociality, apathy, avolition, right? See here, all positive symptoms will happen because of increased level of dopamine in mesolimbic tract and negative in mesocortical tract. Okay, suppose if examiner would have asked you only about the pathophysiology, you could have marked कि this will be because of increased level of dopamine in mesolimbic tract. But in this question, see here, like examiner is mentioning कि symptoms started improving when he was started on haloperidol. So remember here, because of increased level of dopamine in mesolimbic tract, there will be positive symptoms, and these symptoms will improve when, like, patient will be starting on haloperidol when there will be decreased level of dopamine in mesolimbic tract. So here answer will be A. Okay, you have to be careful about the language of the examiner. Next question. A 40-year-old man on carbamazepine has developed psychotic symptoms. Which of the following drugs should not be given to this patient? So this will be related to the side effect of this drug. So can you tell me what are the, see, what are the side effects of the drug? What are the side effects of the carbamazepine? Nausea and vomiting, most common side effect. But what are the grave side effects of carbamazepine? See here, agranulocytosis means there will be destruction of WBC and neutrophils. Next, there can be Steven Johnson syndrome, there can be aplastic anemia, and there can be hyponatremia. Okay, so see, agranulocytosis, destruction of WBC and neutrophils. As I have taught you that second generation antipsychotic drug, which is called as clozapine. Can you answer me? What are the grave side effects of clozapine? See, all metabolic side effects will be there. Hyperglycemia. So there can be, so there can be, see, there can be weight gain, sedation, all these, right? But what are the grave side effects of clozapine? Agranulocytosis, myocarditis, and a seizure and of clozapine. See, agranulocytosis is seen in carbamazepine also and clozapine also. So there will be superimposition of this grave side effect. That's why we cannot see, we cannot give clozapine and carbamazepine. 0 points about clozapine, that this is also the drug of choice for resistant schizophrenia, for treatment resistant schizophrenia. What is the meaning of treatment resistant schizophrenia? A patient of schizophrenia who is not responding to minimum 2 antipsychotics. Okay, then drug of choice will be clozapine. Next question, question number 9. A 21-year-old woman A 20-year-old woman is attending the clinic for the first time. She is currently repeating her university examination for third consecutive year. She reports being unable to attend lectures and seminars because she feels anxious while attending them. She dreads being asked a question in front of the group as she is concerned that she will say something stupid. She has been unable to make friends as she avoids conversation out of fear that she will have to talk to more than one person. She constantly worries about others judging her when in conversation, and as a result, she avoids mixing with people as much as she can. She finds relief from her anxiety symptoms when at home. Fear of being watched Fear of being judged by other people, what others will say about my condition. This is called as social anxiety disorder, or you can say what? Social phobia. Social phobia. Fear of being watched by other people and fear of being judged by other people. Okay, what else will say? This is called as social phobia. This is called as social phobia. Here answer will be B. Next question, question number 10. Father slapped elder son. Then elder son slapped his younger sister. After that, younger sister broke the mirror. Which type of defense mechanism is this? Okay, I have taught you in psychoanalysis that what is the meaning of defense mechanism? Say here, id, ego, and superego. Ego will be using defense mechanism, right? Right? Ego will be using some kind of defense mechanism. Ego. So see here, passive aggressive behavior means what? Showing your aggression in an indirect manner. Okay? Intellectualization means what? When a person is using excess of his excess of his knowledge to reduce the pain, you feel good. Displacement, shifting of emotion from one person to another. एक का गुस्सा दूसरे पे उतारना. This is displacement. Next question. A 4-year-old girl is sexually attracted towards her father. This can be seen in which age of children? In psychoanalysis, I have taught you 5 stages of psychosexual development: oral, anal, phallic, latent, and genital. 0 to 1.5 year oral phase, 1.5 to 3 years anal, and 3 to 5 phallic. Phallic. Okay, and 5 to 12 latent, and more than 12 genital phase. Okay, see, remember here, even a 1-year-old child can also derive sexual pleasure, but the see, the behavior will be different. Okay, so remember here, in the oral phase, a child derives sexual pleasure by biting, barking. Anal phase, child will be a child will be deriving sexual pleasure when he will be getting toilet trained. And phallic phase, in this age you will see that most of the say here most of the male kids would like to stay with their mothers, and female kids would like to stay with their father. Okay, so see here, there can be sexual attraction, right, for the opposite sex. So this is good for the bonding, right? Now, so this will be seen in during phallic phase. Phallic phase is in between 3 to 5 years. So here answer will be C. C. Psychosexual stages, right? This is always an important topic. Next question, question number 12. A 3-year-old child is brought to, see, she's a girl child, OPD with features of hand wringing, stereotyped movements, impaired language, and communication development. Basically, this is a case of autistic disorder, autism. So, see, this is a case of autistic spectrum disorder, where sometimes there can be breath holding spells. See, there can be poor social skills and deceleration of head after 6 months. Basically, this is a case of microcephaly also. Remember, all ASD will be more common among male kids than female, except one, Rett syndrome, which is seen exclusively among females because of, see here, which gene mutation? MECP2 gene mutation, where, see, there can be symptoms like autism, like there can be impairment in social interaction, language, behavior. After that, microcephaly after 5 to 12 months, there can be breath holding spells, right? See here, so all these signs and symptoms are related to Rett syndrome only. Remember here, one important point, please write down. Remember, up to 1.5 year back, there was no any medicine for this Rett syndrome, but there is a new drug which is launched market for Rett syndrome. And what is the name of that drug? name of the drug? Trofinetide. Right? Please write down. This is the name of drug. This is a new drug. This is new drug for Rett syndrome. What is the name of drug? Remember, please, very, very important drug. Trofinetide. Right? This is a new drug for Rett syndrome, only for Rett syndrome. Next question. Which test is a better option to differentiate psychogenic and organic cause of erectile dysfunction? See, for erectile dysfunction, remember, 90% cases are psychological. Only percent will be organic, where there will be mellitus. Any case, like even arteriosclerosis, neuropathy, right? Even, like after using some of their drugs, after abusing a substance, right? Fine. So how to differentiate this? Suppose if I do Doppler, so can you tell me what is the meaning of Doppler? So where do we use Doppler? Where we have to check blood flow and pressure, right? So this is called as penile tumescence. This is called a penile tumescence. When you do is completely normal. Being what? Psychological. If blood pressure and flow both are abnormal, then there will be organic causes. This is called a penile tumescence. Remember, squeeze technique and stop start technique. These are for premature ejaculation. Premature ejaculation. Okay, fine. Next question. Question number 14. Which of the following drugs should not be given in case of insomnia? Any drug. Say, remember, any drug which is a stimulant should not be given in a case of insomnia. What can be the drug which can be given for insomnia? See, the drug which will be sedating the patient, like benzodiazepine, Z compound, even mortiazepine. That's why these drugs should be given only in nighttime, because they will be sedating the patient and patient will sleep. What about modafinil? Modafinil is a CNS stimulant. If you give one tablet of modafinil, patient will not be able to sleep. So modafinil be given for the treatment of insomnia, right? Here answer is D only. Answer is modafinil. Modafinil. ठीक है. Next question now. Just a minute. Yes. Okay. Screen is visible now. Yes. So here, see here, explaining about question number 14, where answer was modafinil. D answer. Yeah, now my screen is visible. I hope so. Yeah. Okay. All right. See, question number 15 now. Okay, which following is a wrong match? Right? Remember here, yeah, okay. See, I'm showing you question number 15 now. So, see, question number 15, which of the following is a wrong match, which you can easily rule out here, MChat or cage or audit. These are actually questionnaire system, right? These are questionnaire system here. So the question what? Which of the following is a wrong match? So your answer will be C. Right now, I'm showing you question number 16. A 21-year-old female, a 21-year-old female is presented to OPD with complaints of nutritional deficiencies and weight loss. She avoids further evaluation. It is found that she is not image. This question 100% you can see all the symptoms are same, like patient is having anorexia nervosa, but remember here in anorexia nervosa there will be image consciousness. Here also, see, remember here she is not image conscious, she is not image conscious. Same symptoms like anorexia nervosa, but she is not image conscious. Okay, so why she is not eating the food, why she is avoiding the food? Because she does not like the taste or smell of food. So here answer will be D, right? Avoidant restrictive food intake disorder. Okay, remember here, like even in bulimia nervosa, anorexia nervosa, there will be image consciousness, but avoidant may no image consciousness. Next question. See, 17 question I'm showing you now. A 34-year-old man is referred to the outpatient clinic reporting ongoing difficulties with his landlord. He has been in several arguments with him and says that his landlord is to blame for these. He admits that he drinks late into the night but denies his landlord accusation that he's playing loud music. Several arrests, assaults, violent. See, all these are what? All these are what kind of activities? All these are antisocial behavior only. All these are antisocial behavior. So this is a case of which type of personality disorder? Antisocial personality disorder, which is also called as dissocial. Dissocial. Okay. Remember here, dissocial. So here answer will be B only. Next question. Okay, now I'm showing you question number 18. A 70-year-old male patient is brought to OPD clinic with 1 year illness, characterized by marked forgetfulness, personality changes, poor self-care, visual hallucination, suspiciousness, and progressive deterioration in his condition. MMSC is mania is also, it be seen in young age. Now, either there can be schizophrenia or dementia. First of all, 70-year-old. See, how much is the normal MMSA score? See, in total a score will be 30, equal to or less than 24. It means what? patient is having any organic mental disorder, right? Organic mental disorder like delirium, dementia. So see, very, very slow and progressive disorder. Here answer will be D only, dementia, because delirium is acute condition. See, 19, which of the following is not associated with PTSD? Okay, symptoms for PTSD, right? Like it should be there for more than 1 month. Less than 1 month will be called as acute stress reaction. Within 48 hours, this will be, see, less than 1 month will be called as acute stress disorder. Less than 48 hours, acute stress reaction. But remember here, after 6 months also it can occur, which is called as PTSD with a delayed onset. So here D will be the answer. Here D will be the answer. This much point is clear to everyone. Chalo, 19 question we have completed. Last question for you people. A 40-year-old male has the fear of leaving home and see traveling alone and being in a crowd. He often develops palpitation and sweating in these situations. He avoids public transportation to go to his workplace. So can you answer me? Some of you might be thinking by social phobia. No. Social phobia means what? Fear of being judged by other people. Fear of being watched by other people. Okay. Minimum two or more than two fear is called as agoraphobia. This is called the agoraphobia. Fear of, like agoraphobia means what? Fear of being in the closed place, fear of being in the open place, right? Fear of going somewhere alone, fear of using the public transportations. Minimum two, right? So how to treat phobia? Like first of all, behavior therapy, like exposure therapy. And if you have to start the medicine, you can start with SSRI and benzodiazepine. Okay. Chalo, I hope you people have done good job. Thank you so much. I wish you all the best.